Hello everyone. We welcome you to the next series of Health Talk powered by SGR Knowledge Foundation. हम सबको पता है कि फरवरी is the month of heart. But no matter what month, we can always take out some time to take care of our heart. I think हम सबको ये भी पता है कि cardiovascular diseases वर्ल्ड की सबसे वन कॉज है डेथ के लिए और जो डेवलपिंग कंट्रीज हैं उसमें इसका नंबर बढ़ता चला जा रहा है। तो क्यों ना आज हम बात करें कि हम अपने हार्ट को हेल्दी रखने के लिए किस किस तरह की चीजों को अपनी लाइफ में मॉडिफाई कर सकते हैं। और हमारे साथ बात करने के लिए आज जुड़े हैं डॉक्टर निकुंज पवार सर। डॉक्टर निकुंज इज सीनियर कंसल्टेंट कार्डियक सर्जन। He did his MH cardiac surgery from Christian Medical College, Vellore, with a gold medal. Sir is presently Director, Cardion Hospital, Dhantoli, Nagpur, and he's also elect Cardiothoracic Society, Nagpur. Sir has a 32 years of experience as cardiothoracic and vascular surgeon, former professor and HOD cardiothoracic surgery, Government Medical College and Super Speciality Hospital, Nagpur. Sir has worked previously as a fellow cardiac surgeon, Royal Melbourne Hospital in Australia, fellow cardiac surgery, Wellington Hospital, New Zealand, specialist cardiac surgeon, Royal Hospital, Oman. His areas of interest include beating heart surgery, aortic and mitral valve repair surgery, teaching and training of upcoming cardiac surgeons, established a heart transplant center at Government Medical College. Sir has been constantly contributing in the print media as well and has several publications in national and international journals. Sir is a keen sports person also, which can be seen from his fitness, sir. Thank you so much, sir, for being with us. Dr. Nikunj, we welcome you on our series today.
Thank you so much for this lovely introduction.
सर, जब बात होगी दिल की सर, तो क्या हम सबसे पहले ये जाने कि हमारे देश का दिल कैसा है सर? Compared to other countries, are we healthy with our heart?
Unfortunately, no. बहुत तेजी से हम लोग वर्ल्ड कैपिटल फॉर हार्ट डिजीज की तरफ जा रहे हैं. And two things I feel are responsible for that. One is the obesity pandemic that's happening in our country. And secondly, it is that we are being called as the diabetic capital of the world. तो ये दो जो चीजें हैं are leading us very fast to reach the dubious distinction, as we must say, of being one of the countries with the highest cardiovascular disease prevalence.
तो लेकिन पहले हम ये कहते थे कि वेस्टर्नाइज कल्चर में ही ये बीमारियां हार्ट की ज्यादा देखी जा रही थी, लेकिन अब शायद हमारा कंट्री जैसे आप कहते हैं कि काफी ज्यादा हो गया है कि हार्ट डिजीजेस बहुत हो रहे हैं। तो लेकिन हम ये भी देख रहे हैं कि यंग एडल्ट्स में भी हार्ट डिजीज की प्रॉब्लम बढ़ रही है। तो सर उस हिसाब से हमारी कंट्री कितना खराब परफॉर्म कर रही है विथ यंग एडल्ट्स ऑल्सो?
Young adults is a problem, I guess. It's a pan-world problem. And मुझे ऐसा लगता है कि some factors that are leading to this problem, especially in India, are if you look at our previous generation, our elders, their basic mode of transport was either walking or cycling.
Yes, sir.
आज वो चेंज हो गया है. बेसिक मोड इज स्कूटी. वॉकिंग जीरो ही हो गया है. थोड़े से और एफ्लुएंट है वो लोग गाड़ी चलाते हैं, कार लेके जाते हैं. सो जो एक कंपल्सरी फिजिकल एक्टिविटी हमारे एल्डर्स में थी, दैट हैज वर्चुअली वैनिश्ड फ्रॉम आवर जनरेशन, एंड दैट इज showing its effect now as the younger generation is coming into the thing. We are seeing the effect of that inactivity. Now, as I said in one of my interviews before also, is that हम लोग जब छोटे थे तो शायद साल में 2 बार बाहर खाना खाने जाते थे. And that too was a very big celebration and an occasion where we used to go out. आजकल देखा जाए तो फूड ईटिंग आउट, आप वीकेंड में जाएंगे तो शायद आपको कहीं जगह ही नहीं मिलेगी ईटरीज में. It's so packed. Even the roadside stalls are packed and full. Now, one thing is very sure, if you know, दैट अगर आपको अच्छा खाना बनाना है तो उसमें तेल, घी और मसाले का यूज करना जरूरी है. यू कैनॉट हैव अ फूड विच इज वेरी टेस्टी एंड डाइट हेल्थी. ये दो चीजें
ओके
साथ
सर.
नहीं जाती. ये दो
यस
चीजें
सर.
साथ नहीं जाती. नाउ द टॉप इट ऑल, what has happened in the past 5 years or so is the advent of these fast food apps. The aggregator apps have come in. Now ये apps क्या कर रहे हैं, जो कुछ लोग शायद साइकिल लेके अपने बगल वाले उधर जाके खाना ले आते थे जाके, अब वो लोग भी घर में फोन के ऊपर बैठ के खाना ऑर्डर कर रहे हैं. So
यस सर.
it has become like from bad to worse, the comfort. So that's why I think, and that is one is food, I must say, but the other what is important is their exercise habit. Most of
यस.
us are so engrossed in our work that we hardly find time, or we don't want to find time. We don't want to find time for exercise. We think it's always can be done tomorrow, and that is leading to a lot of young adult problems for the heart.
यस सर.
Third thing which I'm seeing is the stress factor that the young adult is facing. They have very high goals. No harm in having high goals, but then in an effort to try and achieve them, some do achieve them, some achieve them very easily, some cannot. And that constant process of achieving a very high goal or a very high sort of workload that has been imposed on them by their employers is leading to extremely stressful existence. So अगर हम सब इक्वल कर दें, सब चीजों को इक्वल एक तराजू में रख दें, तो मेरे ख्याल से जो एक चीज जो उभर के आती है वो है स्ट्रेस.
ओके.
तो स्ट्रेस इज समथिंग विच इज अनमेजरेबल. हमारे पास कोई जैसे बीपी मेजर करने के लिए मशीन है. We
यस
have
सर.
machines to measure their temperature. There is no machine to measure stress. And you are reeling under stress. It may be work-related stress, it may be financial stress, it may be, just stress of your studies or whatever. The stress is become a constant feature with the young adults. And some who cannot cope with that, they succumb to having heart problems.
सर मुझे ऐसा लगता है कि आपने जो रिस्क फैक्टर्स कहे जिसके कारण यंग एडल्ट्स में नॉर्मली हमें आजकल हार्ट प्रॉब्लम दिख रही है, उसमें एक डाइट है, एक लाइफस्टाइल पैटर्न है सर, और तीसरा
जी.
स्ट्रेस फैक्टर है. सर इसके अलावा भी कोई रिस्क फैक्टर्स है जिसके बारे में हमको अलर्ट रहना चाहिए?
इसके अलावा जैसे what we have seen now is very some young adults coming with thrombus in their artery. That means a clot in their blood
ओके
vessel.
सर.
और जैसे जब जिसका हम लोग कई बार क्लॉट डिसॉल्विंग मेडिकेशन देते हैं और एंजियो करते हैं, तो we see that they have no residual disease inside the vessel, but there definitely was a clot which has given rise to the heart attack, and then it has dissolved. Now, clot formation has been seen post COVID pandemic. The COVID virus or the COVID proteins that enter your system are known to cause some form of blood clotting. So we are seeing people who have undergone either COVID infection or have क्या कहते हैं उसको, COVID some form of inoculation without realizing or not realizing. They are also sort of I feel कि एक risk factor उनके लिए बन गया है जो पहले generations में नहीं था.
सर एक और बात है सर, जैसे आजकल आप लाइफस्टाइल की बात करते हैं सर, तो कुछ ट्रेंड आ गया है कि हम स्मोकिंग एंड अल्कोहल को कल्चर में ही देखने लग गए हैं आजकल. काफी
जी.
यंग एज से बच्चे स्मोक कर रहे हैं. तो सर जो
जी.
ऑडियंस हमारी सुन रही है और जो हाथ में सर लाइफ चल रही है, तो आपको क्या लगता है कि क्या लिमिट होनी चाहिए स्मोकिंग की और अल्कोहल की भी सर?
I'm sure there are a lot of alcohol companies who have produced data to say that alcohol is good. And I do move in certain social circles where some of my friends do come and tell me कि देखो ये देखो ये देखो, 2 पैक पियेंगे, 3 पैक पियेंगे, बहुत अच्छा रहेगा. But in my opinion, there is nothing like somebody stops his drinking. लोग 2 पैक के लिए खुद को झुठलाते हैं. So my idea is don't.
Okay.
There is nothing like I am happy. I am a very strict person. I drink only 60 ml. मैंने तो शायद ऐसे कोई नहीं देखे. I have not
Right,
seen
right.
somebody who does that. It's not
Right.
true. या तो वो आपको झूठ बोल रहे हैं, आपसे ज्यादा वो खुद को झूठ बोल रहे हैं. तो ये समझने वाली बात है कि अगर आप खुद को झूठ बोलोगे तो किससे बचोगे फिर? आप दूसरे को झूठ बोल के तो कुछ बच जाओगे, पर जब आप खुद से झूठ बोलोगे तो देयर इज नो
Yes.
एस्केप. So you have to be truthful to yourself in the sense that you have to tell that are you really having that little amount which some company, some alcohol company has produced and puts on WhatsApp and said that yes, you can drink this much and you will be fine. I don't personally think so. So alcohol, best avoided. Tobacco in any form, absolutely any form, should be totally avoided. Now,
Okay.
if you say this central India, जिसमें हम southern MP, Chhattisgarh and Vidarbha, we include all those areas, there is a big culture of eating kharra. You know, ये kharra has caused immense problems, right from cancer of the mouth to coronary artery disease to as simple as constant bowel disturbances. तो हार्ट डिजीज तो आएगी तो शायद हम उसको ट्रीट भी कर देंगे जब बनेगी.
Okay.
We have
Right.
good algorithms to treat heart disease. But what about your cancer? What about your other problems that are going to come from, let's say, smoking? If you smoke, double whammy है. Double whammy कैसा है? You are taking tobacco, which is constantly damaging your blood vessels. Plus, you are also inhaling that smoke in your lungs. Now, ये स्मोक जब लंग्स में जाता है, once it enters your lung alveoli, alveoli का मतलब है ये these are the terminal part of your lung जहां पे हमारा blood oxygenation होता है. These alveoli, they dilate, they become like little balloons. तो उनका जो actual oxygen transport and oxygen mixing का function है वो zero हो जाता है.
Okay.
Such patients are neither living well nor they are dying. They are sort of in such a bad state, they require oxygen sitting at home. You know, their life is a misery. As I said, if you have cancer, well and good. God forbid, if you have cancer, lung cancer हो गया आपको smoking के कारण, fine, okay, go. You are gone, your life is written. But what about this? This COPD, as we call it, as chronic pulmonary obstructive disease, this particular problem is so bad that patient neither lives nor dies. If he lands up with coronary artery blockages to top it all, then it further aggravates these problems. So my suggestion is tobacco is in any form, absolutely no. There is no social tobacco taking. Nothing like a social tobacco taking. आजकल कुछ हुक्का पार्लर में बैठ के हम हुक्का तो पी रहे हैं, हुक्का में तो कुछ something nice flavored है. No, these are all the ambits to make you start smoking. So be away from them. The youngsters is my advice. ये फैशन है, पर अगर आप इसके आदत में पड़ गए तो ये आपको ले डूबेगी.
और सर आगे की सीरीज में हम जरूर बात करेंगे आपके साथ कि जो ये स्ट्रेस के कारण स्मोकिंग होती है इसके लिए आप क्या टिप्स देंगे. लेकिन सर ये बताइए कि अगर किसी को कोई कार्डिक प्रॉब्लम हो रही है उसको क्या सिम्टम्स आ रहे होंगे जिसका उसको ध्यान रखना चाहिए.
हमारे एक टेक्स्ट बुक हुआ करती थी पुराने जमाने में जिसमें एक क्लासिक कार्डियक सिम्टम्स दिया करते थे जो आज भी हम लोग पहले बताते हैं. वो है कि हमारे ये छाती के इस पोर्शन में हमको चेस्ट पेन होता है, पेन होता है. पेन कैसा रहता है? निचोड़ा, अंदर कोई निचोड़ रहा है, इस तरीके का पेन होता है. पर हर आदमी ये पेन लेके नहीं आता. कुछ लोग आते हैं जो बार बार हमको बोलते हैं हमको एसिडिटी हो रही है, एसिडिटी हो रही है, और 6 महीना 8 महीना दे आर टेकिंग ट्रीटमेंट फॉर एसिडिटी, एंटासिड ट्रीटमेंट चालू है उनकी. एंड at some point, those who are lucky, mind my words, those who are lucky, they reach a cardiologist who diagnoses them with a coronary artery disease and उनका आगे ट्रीटमेंट होता है. तो ये एक बेसिक सिम्टम है. जो आगे के जो सिम्टम्स हैं वो है यू कैन गेट पेन इन योर नेक, शोल्डर्स, you can get pain in your both shoulders which will be radiating to your arms. एक पेशेंट मेरे पास आए थे जिनको सिर्फ दांत में पेन था और उनकी डेंटल ट्रीटमेंट हुई पूरी. They had a long dental So they was found out that the dental pain was not anything else, but she had significant coronary artery disease. Then other symptom which is very pertinent, especially in the diabetics, is they get no chest pain.
Right.
They have no chest pain. What they have is breathing difficulty. थोड़ा चलेंगे बोलेंगे साहब सांस लग रही, मराठी में आते हैं साहब धाप लगते मला. So these are the symptoms which you have to be very acutely aware of, and you have to tell them that let's get. My idea about heart is very simple. Heart is an organ which can be very elegantly treated. We have medications, we have angioplasty, we have bypass surgery. We can treat these very elegantly and give you at least 1 to 2 decades of life after that. So if a patient comes with suggestive of these symptoms, I always tell them to rule out heart first. अगर heart normal है, then I say go ahead and take whatever else. जैसे आप एसिडिटी की ट्रीटमेंट करना चाहते हैं तो एसिडिटी की करेंगे, या आपके शोल्डर पेन है, फ्रोजन शोल्डर होता है कभी कभी किसी को, तो we give them frozen shoulder treatment. Sometimes they have cervical spondylitis, which basically mimics a heart. We treat that, and very rarely we also find patients with anxiety. Anxiety mimicking heart problems. Then we treat their anxiety. Anxiety is not going to kill you. Spinal problems are not going to kill you. Frozen shoulder is not going to kill you. Acidity is not going to kill you. But your heart is the one which is going to kill you. So better rule out that you have a heart problem. If there is a heart problem, rule it out and be happy and live your life in a sort of a comfortable manner.
डेफिनेटली सर. सर मुझे लगता है कुछ लोगों को ना इस बात का डर भी रहता है कि ट्रीटमेंट हो रहा है, ट्रीटमेंट बहुत लंबा चलेगा, दवाइयाँ बहुत ज्यादा खानी पड़ती हैं. सर मैंने कई बार सुना भी है कि लोग कुछ समय तक दवाई खाते हैं, उन्हें कुछ रिलीफ मिल जाता है, फिर वो खुद से दवाई कभी कभी कम भी कर देते हैं सर. तो सर ये कितना खतरनाक होता है हमारे लिए कि हम अपनी दवाई को कंटिन्यू रखें और डोज कंप्लीट करें.
राइट. नहीं, देयर इज नथिंग लाइक कंप्लीशन ऑफ डोज फॉर हार्ट प्रॉब्लम्स. You have to take, if you are diagnosed with a heart problem, then your primary prevention is over. समझिए. So now what comes is secondary prevention. That means two things. Either जैसे आपको हार्ट में ब्लॉकेजेस डायग्नोज हो गए, आपकी एंजियोप्लास्टी हो गई या बाईपास सर्जरी हो गई, या ऐसे ब्लॉकेजेस है जिसको कुछ नहीं करना है और हम उसको सिर्फ दवाई से ट्रीट कर रहे हैं. Now once that situation arises, you have to come to a point where we call it a secondary prevention. Now ये जो already existing problem है, they should not progress, or if they progress, they should progress at a slow pace. Give them longer time to survive with those problems in their body. उसके लिए drug therapy is a must, and drug therapy is a must lifelong. It's not a drug therapy कि आज हमने दे दिया और 6 महीने, 2 महीने, 4 महीने में. The defaulting is because of few things. One is an economic issue. The drugs that are coming is constantly जैसे 5 से 6 हजार रुपए महीना खर्चा करना पड़ता है, and that sometimes become a big burden on the patient. Sometimes हमारे पास patient आते हैं जो बोलते हैं सर हम generic drugs लें क्या? We definitely say take generic drugs. There is nothing against generic drugs, but then they should be aware that a generic drug, there is no control on the manufacturing process perhaps. So a generic drug is good, perhaps if the pharmacist can assure them that they are made in a good process. So generic drug can definitely, as being advertised, reduce the cost of medication to a great extent. तो अगर पेशेंट कुछ नहीं ले रहा है, उससे बेटर है तो कुछ ले ले. So if he is taking certain medications for lifelong, then if he decides to go on a generic form of medication, well enough, good enough. So then at least he is taking medications which will keep that disease in certain control, certain amount of check for life.
तो जैसे आज का हमारा टॉपिक ये है कि हमारे पास हार्ट डिजीज किसी भी एज में हो सकती है सर, तो कितना जरूरी है कि हम डायग्नोज करें और किस एज से हमको स्टार्ट करना चाहिए अपने हार्ट की फिटनेस को चेक करना सर, क्योंकि हम ये नहीं सोच सकते कि अब ये 60s के बाद की बीमारी है हमारे लिए.
नहीं, अब जैसे अब आप अगर देखेंगे इस वक्त, तो my personal youngest patient who has undergone bypass was 21 years of age. Okay, he has undergone bypass, 21 years of age. We are sequentially doing angioplasties on younger and younger patients and bypass on younger and younger patients. So I would today say that 30 is the age that you should start thinking about your heart. Right from the age of 3 years, 3 साल की उम्र से हमारे हार्ट में फैट के स्ट्रीक्स देखे जाते हैं. Now they will grow, they will stay stable, or they will not be at all a problem. Depends on how you live your life. So what is most important is the younger generation का जो टेस्टिंग का जो जैसे आपने सवाल पूछा कि टेस्टिंग कब से करना है, तो I feel 30 should be the age now, which about a decade ago was 40. Now I feel it's 30. 30 के एज में अगर कोई भी आता है with even little bit of heart symptoms, we should go ahead and investigate him for heart. Simultaneously एक 30 years का जो है, जैसे जो employment में है, wherever the employer should make sure that once in 2 years, if or once in 3 years, they should have a cardiac checkup from ties with certain hospitals, private, government, whatever is your capability, and get their checkups done. It will help catch a cardiac disease much earlier. As I said, it's a very elegant treatment protocol. We can treat heart diseases and we can keep a patient alive for 1 decade, 2 decades. So it's a long time. So there is no point in denying the fact that the disease burden has shifted to the younger age group. We should accept it. The younger generation should accept it, that the disease burden has moved to a younger platform, and they should act and look at that, and they should work towards keeping themselves healthy and getting themselves checked ever so often, as advised by the doctor.
That's a great information for us, sir. So can I add to this कि अगर हम चेकअप के लिए जाते हैं तो सर हमें कौन से चेकअप्स करवाने चाहिए ताकि हम अपने हार्ट की स्ट्रेंथ को चेक कर सकें?
Right. We have what we call it as a very basic test, what we call it as blood hemoglobin. That is the basic test. We have blood cholesterol, which tells us whether there is any rising cholesterol trend in the person. Third thing we do is homocysteine. Homocysteine is also a thing which can cause sudden clotting of the blood. Then there is, we do what we call it as CRP. That is a protein, a test which shows that there is inflammation in the body. And inflammation, a raised inflammation in the body is well related to having vascular endothelial problems, which in turn can lead to coronary artery and other arterial system blockages. So these are then you also at that time of health checkup check whether the kidneys are okay, check whether the liver is okay. So these are the very basic blood tests. Now ECG is a good test if you are having a trouble at that moment or if you have had a trouble in the past. So ECG उस सेकंड का हमारा विंडो है. It doesn't tell you anything after what's going to happen. Now it also tells you something that has happened in the past. तो आपने एक बेसलाइन टेस्ट में अगर आपको ECG में दिखता है कि there is some issues with the patient's coronary arteries, you can advise him further test. But if ECG is normal, blood tests are normal, patient is otherwise healthy, there is no family history कि इनके घर में बहुत early coronary artery disease का issue है. Such patients we can just follow them up say in a 2-yearly fashion or a 3-yearly fashion. But अगर किसी का कोलेस्ट्रॉल रेज्ड है, अगर किसी का बॉडी इन्फ्लेमेशन मार्कर लाइक सीआरपी रेज्ड है, अगर किसी के ईसीजी में प्री एग्जिस्टिंग चेंजेस हैं, such patients should go for the next level of test which we call it as a treadmill exercise test. So treadmill exercise test is something which will simulate a situation. हम जब वॉक करेंगे और हमारे पूरे बॉडी में ईसीजी लगा हुआ रहता है. ईसीजी जो चलते वक्त हार्ट को स्ट्रेस करते वक्त जो रिकॉर्डिंग होती है, that tells us whether the heart is under stress and is underperforming or not. And if the heart is underperforming, that shows in our ECGs. So once you have a stress test which shows that there is an underperformance, you can go to the next test. अगर आपको बहुत ज्यादा अलार्म नहीं करना है तो you can go for a CT coronary angiography, which is very prevalent in most of the cities now. और अगर आपको गोल्ड स्टैंडर्ड चाहिए है कि भाई नाउ जिसको बोलते हैं आर या पार, कि भाई it is this side, yes I have coronary artery disease, no I have no coronary artery disease, then it's coronary angiography, which is done in a cath lab, which is a formal test. The risk of this is probably 1 in 1 lakh patient has a problem or issue, so it's an extremely safe test, and it can be done as a daycare, and patient can come in, get the test done, couple of hours later he can go back home, either knowing that he has a problem or knowing that he has no problem.
सर जब भी हम ट्रीटमेंट की बात करते हैं तो ट्रीटमेंट से जुड़े हमें बहुत सारे डर भी होते हैं कि अब हम हार्ट की सर्जरी कराने जा रहे हैं, चाहे आप एंजियोप्लास्टी बोलें, तो भी हमको लगता है हमारे हार्ट की ही सर्जरी हो रही है। तो सर इस फियर के लिए आप कैसे मोटिवेट करते हैं लोगों को कि हमको डरना नहीं चाहिए और इसके ट्रीटमेंट प्रोटोकॉल को पूरा फॉलो करना है हमें?
Motivation is basically you have to show them the benefits. Sometimes patient ask me, sir, इसका फायदा कितने दिन होगा? And I tell them 10 साल. And suddenly they say, सिर्फ 10 साल? Now I have to tell them, now you just stop, let's stop this, pause this conversation here. आप अपने 5 साल पहले देखिए आपने क्या अचीव किया और उसके 5 साल पहले आप देखिए आपने क्या अचीव किया. You will realize that you have achieved a huge quantum in the 10 years that have passed. And that's what I'm giving you, to achieve another huge quantum in the 10 years that are going to come in front of you.
Right.
So that is something which motivates them. And the flip side of it, as I said, flip side is very simple. I can get a brain surgery done. My brain surgery fails. I am brain dead. My body works. I am lying, but I am alive. I go for a, let's say, an abdominal surgery or a ortho हाथ की surgery, कुछ भी करूं मैं, वो फेल हो जाते हैं मेरी, I am still alive, I am not dead. The organ which determines life in our body is heart, and heart alone. There's no other organ which determines life. So now if your heart is, if you are going to be careless and you are going to lose out on this, then it's going to be a very sad
There's no
event.
life. Yeah, no life.
Exactly. It's a sad event. And I always tell them, I said, let us say an engineer comes to me, or a person who has basically put in, let's say, 30, 25 to 30 years of life and is doing work. And he comes to me and asks me, why should I get operated? I said, people like you are only 5% in this country, even less. So if you are just 5% of the population, why do you want to go away for nothing? Like if you ask me, I'm a cardiac surgeon, I am 0.1% of the population of this country. There are that many cardiac surgeons in this country.
Absolutely.
So if I am careless, a country is going to lose, for my carelessness, somebody who has acquired 32 years of experience in his field for nothing. But just because I am scared, I don't want to get this done. And the fear comes from the simple fact is heart determines your ability, your strength. जो शेर मुहावरे जितने बने हुए हैं वो दिल, कलेजे वाला दिल है, दिल वाला आदमी है, दिल बड़ा है, दिल दिल पे है. तो जो एक इनग्रेन है हमारे इसमें कि अगर हमारे हार्ट के ऊपर कोई ट्रीटमेंट हमारे कलीग्स को पता चल गई तो वी आर गोइंग टू बी आउट ऑफ कंटेंशन ऑफ प्रमोशन एंड एवरीथिंग. बट आई विल गिव यू अ वेरी सिंपल एग्जांपल. Our ex-Prime Minister of this country, Dr. Manmohan Singh, twice he undergone heart surgery and he was running the country.
Right.
So that is nothing more than that. You know, you cannot have a higher job which is bigger than that and higher in caliber and stature, where a person can do and perform perfectly, fully functional. So that's what we want to achieve in you. That's what we want to give you, is a fully functional heart, where you should have no fear कि भाई मैं अगर फील्ड में दौड़ रहा हूं तो शायद मुझे हार्ट अटैक आ जाएगा and I'll drop dead. No, we don't want that at all. We want you to go into the field. We want you to go where you work and be fully confident that yes, with this medication and this treatment, my heart is safe and I'm going to work full strength, full steam.
Sir, all applause to you, sir. With your this, I think this content only people will start thinking about their heart. सर एक और क्वेश्चन मुझे पूछना था सर, जो मुझे खुद पर्सनली भी लगता है कि कभी कभी लोग अपने फिटनेस पे इतना ध्यान देते हैं कि वो सिर्फ मसल ट्रेनिंग पे काम करते हैं और कार्डियो नहीं करते हैं, और इसका हमने कई बार देखा है कि आफ्टर वर्कआउट लोग कोलैप्स भी किए हैं. तो सर हाउ इम्पोर्टेंट इज टू फोकस मोर ऑन योर कार्डियो एक्सरसाइजेस?
वो बिकता है, जो शेर मुहावरा चलता है, जो दिखता है, जो बिकता है, तो पीपल वांट टू लुक गुड. फॉर दैट दे डू मसल ट्रेनिंग, दे वांट टू बिल्ड अप अ बॉडी, दे ईट प्रोटीन्स. नाउ if you are eating external proteins for bodybuilding, something which is there. There are a lot of trainers. There are a lot of people who give you steroids to enhance and hasten your. Um, I said, yeah, why not? Then my wife was the biggest supporter. She always said, no, I like your voice. You sing, you sing, you sing, and I never felt confident to sing. मुझे लगता था यार लोग हंसेंगे क्या गाता है कुछ तो भी जबरदस्ती के तो I said no. Then she always used to encourage me, तू गा तू गा तू गा, and that from one thing led to another. During COVID pandemic when it came, we were all clustered at home, you know, or even the medical fraternity used to go work hard in the hospital and come back. So एक idea आई मेरे को कि I said how to de-stress everybody along with me. So there suddenly there was this new platform. As now this is WebEx is there. We have this platform called as Facebook Live. And I tried it once or twice. I said, this is something good, which is instantly you can go live on. I got a couple of my friends who were doctors and who were singing. I said, let's do a live show. Live show, Facebook Live. There is nothing recorded and we'll not play it later on. We'll play it on live. So a couple of them agreed. We got together at my house. I had all the basic necessities to go live. We went live and that was a success. Since then, we call the group as Swar Docs.
Okay.
It is doctors who sing. Swar ke doctor jo hai.
अरे वाह.
Yes, so throughout the pandemic, we held about almost 25-30 programs. We held almost once in 15 days. So it used to be a process. We used to call. So we have about a 40-45 member squad now with us in Squad Docs. Doctors who have shown their interest to sing. And it's a stress buster for them also. We have about 2 or 3 days of practice. They come to my house. We all get together and we sort of chit chat, plan, arrange, throw away, then practice. You know, so all that is like a extreme stress relief for everybody. And Sunday, it's usually on a Sunday evening. The live program happens, and we sort of just chill out during and after the
So
program.
we can also have a bite on that, and we can just log in and search for Swara Doctors, and we can get to hear you someday, sir.
No, this Sunday it is there.
Okay.
So this Sunday, which is tomorrow.
Yes, sir.
I'm doing it almost after a gap of almost after I must say 4 months we are doing it. But yeah, if you search me on YouTube, this time it will be YouTube Live. You search my website Nikunj Pawar and then you'll see me there on that. Yeah.
Nice to hear that, sir. So I think the real mantra is that you should work with a passion. It should be a passion for you and not a job for you. And secondly, you should have good friends around you who can always be stress busters for you.
Absolutely. You can make them subordinates or you can make them friends. Right. If you keep them as subordinates, you will be the boss and you will have to face the tribulations of a boss. So rather don't be a boss, be a friend and enjoy the work that you're doing. Let everybody enjoy along with you and they will give their best to you. That's what I believe.
So to end the talk, can I ask for 3 tips, quick tips for a healthy heart, sir? What would be 3 mantras from your side?
3 mantras which I would say are most important today is try to be stress-free. Very easy said than done. As I said, I have analyzed lots of people, found that stress is perhaps the single indicator which we cannot measure. And that is, so try to be stress-free. Find a hobby. Find a hobby, whatever it is, doesn't matter, which can distract you from your normal mundane life. And third is, find time to exercise. Don't put it for tomorrow. Do it today. If you want to do it today. If these 3 things you follow, and obviously as said earlier, tobacco, absolute no. Don't touch tobacco if you are in this thing, absolute no. And I have a little thing which I spoke to someone yesterday. I was driving and then suddenly these 3 things came in my head about bypass surgery. I would like to tell them now. 2 घंटे का ऑपरेशन, 2 महीने का अर्धविराम और 2 दशकों का आराम. आइए bypass करिए.
बिल्कुल sir. I think it was wonderful talking to you, sir, and we look forward for more sessions. At this note, that आपका हार्ट, आपके दिल, आपकी धड़कन है और उसको स्वस्थ रखना आपके हाथ में है. अगर आपको कोई भी प्रॉब्लम है आपके दिल से, तो हमारे पास इतने अच्छे कार्डियोलॉजिस्ट हैं जो आपको गाइड करने के लिए रेडी हैं. अपनी डॉक्टर से मिलिए और अपने दिल का पूरा ध्यान रखिए। इसके साथ हम साइन ऑफ करते हैं। अगली बार हम फिर से मिलेंगे एक नई हेल्थ टॉक के साथ। थैंक यू सो मच सर।
so much.
Welcome to Rise Sony Group, a vision beyond.